Hi, my name is Heather. I am a late diagnosed autistic and ADHD human, and today I want to share with you a video that was made about a year ago, almost exactly a year ago, of me smack dab in the middle of an absolute and total meltdown. This video was made after a doctor's appointment in which my doctor casually informed me that I was probably just fibromyalgia and chronic fatigue syndrome after months and thousands of dollars of testing with specialists to find out why I was blacking out, passing out, why my blood pressure was so low, why I could not keep my eyes open. And this video is very raw, and I want to warn you before you partake and watch it. There is a trigger warning in the video because I knew when I was making it that it was going to be difficult to watch. That I do discuss themes of ideation, and this is me at one of my lowest points. So if you so decide that you can make it through this, I appreciate it, and just hang out at the end and we will talk about where I am now. I'm going to put a trigger warning on this just because if anybody does watch it, it might be triggering. I am completely unmasked, unedited, and probably unwatchable. I just left the doctor's office for a follow-up appointment, got a referral to an endocrinologist, and burst into tears 2 minutes being in. Again, the nurse couldn't get my blood pressure. She had to do it manually. It was 70-something over 40-something again. My first week at the new job was last week, and I did make it through most of it. I did have to come home Friday because I literally couldn't keep my eyes open and couldn't focus on any of the tasks at hand. I spent my weekend dissociated, triggered, and pretty frozen in a space I find difficult to describe with words. And I think we all know when things are getting bad for us. Most of us do, I think, physically, mentally. And I know for me, it's getting bad when I start having thoughts of wanting to take a lovely vacation in a padded room. Like, wouldn't it just be lovely to be locked away somewhere and not have to worry about anything and have someone focus on helping me? However that looks, wouldn't it be lovely? And because I'm being honest, and I want you to know how bad it is right now, and this is probably the triggering part, a lot of ideation this weekend. A lot of how do I do it so the insurance will still pay out and my kids can still get something. And look, as a 45-year-old highly masking neurodivergent, I have a toolbox full of tools. Holistic healing, energy healing, Eastern medicine, Western medicine, neuroscience, philosophy, psychology, you name it, it's in my toolbox, but I find myself shaking that fucking box trying to find anything that will work. Because nothing is. I didn't cry in front of the doctor. This time I couldn't even speak. I couldn't look at him. And now I'm going to work. My second week on a job with people that do not know me, on a job that I really hoped I would be able to do, but now I'm questioning even that, because what do I do if I can't do this? I'm broke. I've spent every dime I have on trying to fix myself, on being out of work for the past month, because I couldn't do the last job I had physically. What the fuck do I do if I can't do this? Because right now I feel like I can't do this. Any of it. Anything. And the worst part is I don't know what's happened or how I got to this point. Like I said, that toolbox is stocked full of tools, and it has gotten me through many, many years, and many tough spots, and many traumatic things. But I have reached the bottom, and there is nothing helping. I love you all, and I'm just going to close this with saying there's a difference between ideation and action. Please know that I am okay, and I'm not going to harm myself. And I am going to go to work, and I'm going to try to make this work and make this happen, because I don't have an option. And I know that I'm strong, and I'm smart, and I'm fierce, and I'm all those wonderful things, but right now I am also broken, and I'm tired. And I am at the end of my rope. And I'm going to keep going. Because I don't have a choice. Thank you for listening, and thank you for your comments and your help. And if I don't respond, I'm okay. But I have to pull back and try to figure out how to keep doing this. Because ultimately I am alone in this. And me, myself, and I's got to figure out a way to get it together. But I still think a vacation to a padded room sounds kind of nice. Give me Jell-O, give me drugs, let me sleep. I'm down for that. So that video was difficult to watch for me a year later now, further into my journey, and a year on the job that I discussed there that I wasn't sure I was going to be able to make it through, dealing with these same symptoms for now years that I have been dealing with them, and really getting no medical help. After this video, I did not pursue any further testing or doctor's appointments because it was taking such a toll on my mental health. And it wasn't until 6 months later that I decided to finally seek the help of a psychologist, psychiatrist, to deal with the overwhelm and burnout that I was still suffering with. But I wanted to share this because I felt like it was important to show what an effect our physical body has on our mental health. As a neurodivergent person, it is often very difficult to just suck it up and move on, or to ignore changes like this, and pain, and things that your body is constantly screaming at you about. You can't just suck it up and go on. And this was me at my breaking point, and I wanted to share that because I did, in a sense, recover. Again, my health is not 100%, and I don't know that it ever will be again, but I have learned to accommodate myself and my needs. I have learned tips and tricks, life hacks to make it through with the exhaustion and with the fatigue. And honestly, seeing the psychiatrist really did help with that, because when I explained to her the symptoms that I had been having and the things that I had been going through physically, she made 2 prescriptions with dual uses. One was Cymbalta, which helps with my anxiety, which was at peak after all of this medical trauma, but also is often prescribed for fibromyalgia pain. And she also prescribed Adderall after diagnosing me with ADHD immediately, which was kind of a surprise for me. But the Adderall is also a dual diagnosis usage for narcolepsy and chronic fatigue syndrome. So not only did it help with my executive functioning issues, it helped with the exhaustion. And I'm sure you've heard, if you actually have ADHD, Adderall does not work like it does for neurotypical people. It does not give you that huge burst of energy, and it doesn't, but it does help some with my exhaustion and fatigue. So 1 year later, after finding someone not only who validated my neurotype, and led me towards my diagnosis for autism and diagnosed me with ADHD, she also helped with some of the physical issues and physical symptoms that I had been having. And I cannot tell you what a blessing that was for me, in a recovery and healing process to actually just have somebody listen and say, here, this might help. Because every specialist and every doctor that I had seen was so dismissive of what I was going through. I had been told by multiple male doctors that I was looked like a healthy young woman, and I was neither healthy nor young and struggling quite a bit. So that invalidating experience over and over again, I think really did push me to the breaking point of making this video. And in the video, I didn't even discuss the diagnosis that I was given because it really just felt like a brush off at the time. And since then, I've not been back to see that doctor. He actually, I don't know if he retired or just disappeared. I got a letter from his practice that he was no longer practicing. So maybe I broke him. I don't know. But it certainly broke me. And you can see that from this video. And I appreciate you sitting through this. I appreciate you trying to take a moment to maybe understand my internal world. And I know that my internal world is not depictive of all autistic people and their experience, or all ADHD people and their experience, but I do know a lot of us suffer from common comorbidities that cause a lot of physical issues that are often very mentally distressing. And it is a compound problem that cannot be addressed by just one tactic. And it has taken many months and therapy and medication and the adjunct practices that I was already doing, like yoga and meditation, to get me to the point that I am at now, where I could even watch this video again, much less share it with someone and kind of break down what I was going through and where I am now. So again, I appreciate you watching. I appreciate you commenting. I appreciate you sharing in my experience. And I'd love to hear your thoughts. If you have these common comorbid pain conditions, autoimmune diseases, things of that nature, let me know in the comments, and let's share experiences. Thank you.